In the hushed corners of a bustling city, where the morning sun peaks between towering skyscrapers, resides Dr. Ellen Pryor, a specialist in women's health. Dr. Pryor is renowned for her meticulous care and patience with every patient she encounters. Her primary focus, the Pap test, a routine yet crucial examination for women's health. The Pap test, also known as a Pap smear, is a procedure to test for cervical cancer in women. It involves collecting cells from the cervix, the lower, narrow end of the uterus located at the top of the vagina. This test can detect changes in cervical cells before they turn into cancer, providing an early opportunity for intervention. Dr. Pryor greets her patient, Maria, with a warm smile. Maria has just turned 30 and is about to have her first Pap test. Though slightly nervous, she's comforted by the calming atmosphere of Dr. Pryor's clinic. The walls are adorned with soothing art, and gentle music plays in the background. Maria is led to the examination room, where Dr. Pryor explains the procedure. It involves lying on your back with your legs in stirrups, a bit like a reclined yoga pose. She chuckles to ease Maria's tension. Dr. Pryor uses a speculum, a device that gently opens the vaginal walls, allowing her visibility to the cervix. You might feel a slight pinch, but it will be over before you know it. With precision and care, Dr. Pryor collects a few cells from Maria's cervix using a small brush. She reassures Maria throughout, keeping her informed and at ease. These cells will be sent to the lab. They'll look for any abnormalities, she explains, gently removing the speculum. Maria dresses and sits with Dr. Pryor for a post-exam chat. When will I know the results? She asks, her earlier anxiety now replaced with curiosity. The lab usually takes about a week, Dr. Pryor replies. If the results are normal, you won't need another Pap test for 3 years. If not, we'll discuss the next steps together. She emphasizes the importance of regular tests and early detection. As Maria leaves the clinic, the importance of the routine Pap test becomes clear. Dr. Pryor watches her go with a sense of fulfillment, knowing she's contributed to one more woman's health journey. The Pap test, though simple, carries monumental significance, safeguarding countless lives through early catch and prevention.